we're here to make a new type of news.
New insights, new styles, and new topics every day.
We are News Generation.
Making news just for you. It's November 14th here in Seoul. I'm Shin-Yoon, and you're watching News Generation. Joining me in the studio is Park Ki-hoon.
Thank you for having me.
And Kwon Ju-hyun.
Good morning.
Great to have you back.
Thank you for having me.
Now, both are here to speak on behalf of people in their 20s and 30s. As usual, let's start with our news feed, which covers different hashtags and news items that have been trending on social media over the past 24 hours. The menu served on the Titanic on April 11, 1912, just days before the ocean liner sunk, has sold for around $103,000 at a UK auction. The menu is thought to be the only surviving copy given out to passengers in first class. It points to how the ill-fated passengers were served oysters, beef, and mallard duck. Based on how it's partially erased, though, auctioneers believe the menu was found in cold sea waters once the Titanic sunk or was recovered from one of the lost people. And moving on, with the winter holidays just around the corner, a travel booking platform has surveyed the preferences of Millennial and Gen Z travelers. 1 out of 3 said they were willing to spend more than $2,000 on trips. That's double the average monthly income of people living in Asian countries. 9 out of 10 also said the most important thing when traveling was doing something special they would not forget, such as going to an amusement park or trying out outdoor activities. And last but not least, South Korea is still tackling its bedbug infestation problem. Some are apparently using this public health scare to settle scores, and recently, a secondhand online shop user looked to buy 10 bedbugs in a zipper plastic bag. They said they wanted to use it to avenge their neighbors who made way too much noise. And this post has since gone viral. Many online users debated as to whether this person should be penalized. Some pointed to how this was a stupid idea in the first place because buying bed bugs could also make it more likely that the buyer would end up with an infestation problem themselves. Some others applauded this idea and empathized with how annoying it is to have a loud neighbor. Now, here in the studio, I would like to hear your thoughts on this story, Ju-hyun.
Well, this is absolutely ridiculous, Well, actually, buying bed bugs in order to revenge your noisy neighbors, it is an irresponsible and potentially harmful approach. It not only fails to resolve the issue, but also introduces additional health issues. And I'm sure that at least one bed bug will stay with him or her.
I think so too.
Yes.
I think so too, especially given the fact that South Korea is having this bedbug infestation scare, and officials are on week 2 into their extermination program, so it's not doing the best to help with this whole infestation problem. But what were your thoughts after hearing this story?
Besides the bed bugs, I think it was a very creative way to show one's frustration because I do know how it feels to have a really loud neighbor living upstairs or even next to you. And, I think I'll talk about this a little later, but some people even wear slippers inside their homes to reduce the noise. And people with families and young kids, like I'm sure Ju-hyun as well, they lay out rubber mats on the floor to reduce the noise as well. And I think that's really needed, especially when you live in apartments.
Exactly.
And what I did was I actually went upstairs and knocked on the door very politely. I didn't bring any bed bugs with me. And I said, it's a little loud, could you keep it down a bit? And they were very nice about it. They apologized, saying, oh, I'm really sorry, we'll be a bit more careful. And I'd just like to say to the construction companies, when they do build apartments, build stronger floors, use better materials, because I think that's where we can all start. Just living in places that are less quiet, less noisy, and it is very stressful to have really loud neighbors stomping, throughout the night. So I do understand why this person would thought of, even buying bed bugs.
And for those of our global viewers who might not really relate to how loud our neighbors can be, here in Korea, we mostly live in apartment complexes. And with the thin walls, thin ceilings, it's really hard to live once you have a loud neighbor upstairs. And that was our news feed for this Tuesday. Let's now switch gears into our main discussion topic of the day. My AI voice secretary will tell you more.
Low birth rates are posing a big demographic problem around the world. While many are choosing not to take the path to parenthood, there are some who simply can't. We are seeing a growing number of young people suffer from infertility. Infertility is when one's reproductive system doesn't work, specifically defined as when one fails to get pregnant after 12 months or more of regular unprotected sex. According to the WHO, 1 out of 6 adults worldwide experiences infertility.
Why are we seeing a global infertility problem? Is it found mostly among our generation? Let's find out first by reading into the figures. So Kyun, exactly how many people are clinically infertile, and are we seeing it more among our generation?
Sure. Just last year, the number of infertile patients were reported to be around 240,000, and sterile patients roughly 140,000, so a total of 380,000 patients. Unfortunately, the numbers are in an increasing trend. Also, a survey was conducted by the Health Insurance Review and Assessment Service to show a breakdown of patients treated for infertility in South Korea by age. So if you take a look at the screen, as you see in the graph, the majority of patients were in their 30s, taking up 71%. 80% for people between 40 to 44, 4% people in mid to late 40s, and 7% for people in their early to mid 20s. So we can clearly see that many from our generation are suffering from infertility, which is obviously a worrying sign in the midst of an aging population and having very low birth rates here in Korea. I personally haven't had the chance to visit the doctors to test whether I'm in a very healthy state, but I do fear I will need some kind of treatment because, of my age and I guess my lifestyle as well and the environment I'm living in now. But Juyeon will explain more in detail about the reasons why.
Yeah, and Juyeon, why don't you go right in? What are the reasons behind the younger generation becoming more infertile?
Well, infertility can be influenced by various factors like changing in lifestyles, including unhealthy diets can impact the reproductive health, and environmental factors can also play a role as well. And I think the delayed childbearing, stress, and certain medical conditions can contribute to the growing challenges of infertility issues as well.
And I think a lot of people can relate, like our diet is not healthy. Even though we are a generation emphasizing on healthy pleasure, we do sometimes go for the quick grabs, which is often microwaved. And we do have a live interview with a doctor to explain more on this. But until then, this seems to be a prevalent health issue found among our generation. And have you guys ever experienced talking about infertility with your friends, or is this a topic of interest that you would ever witness or firsthand experience?
Well, I haven't experienced infertility yet as a male because I'm single, obviously. And I think it's only natural for many people who are single and young people to visit a clinic before marriage. So it's not a very common thing to do like when you're single. But I do know a person who is still trying to have a baby. It's been a couple of years already with no luck. The couple is in the process of artificial insemination. Although I do not know what is required for each stage, it did sound like a very long-term commitment, both time and money-wise, and to make it a successful one. And just listening to what she has to go through seemed quite stressful and in some sense like too hopeful at the same time. And it is quite ironic at the same time as you see other couples who get married only because they had an unwanted child. And I've also seen, not directly, like indirectly, people who abandon their babies because they're not ready to take on the responsibility of, bearing them. So.
Exactly. In that sense, life's fate doesn't seem to be fair. Even though you desperately want it, you might be infertile, and there are treatment options out there. But as you mentioned, it just takes so much time and it's quite strenuous. But Juyeon, what about you? Does any of your friends, or have you ever gone through this? Because I know that you have 2 children.
Yes, I do.
So did you
Two
ever?
beautiful
young sons. So could you tell us, have you ever even thought about the possibility of being infertile, and could you relate to all those people who are going through this problem?
Of course, of course. Well, after tying the knot, my hubby and I thought, let's spend some time together, just 2 of us, for a certain period of time. And people kept asking questions. Do you have any problems? Do you have any health issues? But the thing was, we did not know until then. And observing my friends struggling with infertility issues, I noticed that they keep their problems, their struggles very private, not vocalizing it. But however, after having a baby through artificial insemination procedures, they were willing to talk about their experiences, how many shots, and the difficulties of paying for all the procedures. So this actually reflects the sensitivity surrounding this issue
Only after, though.
Only after. They're
They
reluctant to speak that publicly, openly.
Exactly. Throughout the process, I do feel people are quite refrained from talking about it because, and it's only understandable. 'Cause
It is
it's
indeed.
their personal matter. But to talk more about what causes infertility and how we can better perceive this issue, we're now going to include an actual doctor in our talks. Stay tuned for our live interview. We're now going to include a health expert in our talks. It's Dr. Alice Tan from MZmed Women's Hospital. Great to have you with us, Dr. Tan.
Thank you for having me.
All right, Dr. Tan, could you tell us what are the biggest causes of infertility these days?
Right, so here in South Korea, research has shown that among women, the three biggest risk factors for infertility are older age, obesity, and having had a history of a prior induced abortion. For men, the risk factors were abnormal sperm parameters, in other words, not having enough sperm or having no sperm at all. Also problems with sperm delivery, hormonal problems, and then structural problems, including something called a varicocele. Those were the most commonly identified risk factors here in South Korea.
I see.
Dr. Tan, I understand that there are a lot of myths or fake information surrounding infertility, such as it being mainly associated with women. What other myths are there, and could you rebut them?
Right. So the first myth, I think you touched on it very briefly, is that infertility is always due to the woman. That's simply not true. In terms of the underlying factors contributing to infertility, they're fairly well distributed. 1/3 of the factors are female factors, 1/3 are male factors, and the last 1/3, both partners are involved in terms of contributing to infertility, or the cause is unknown. So that's one big myth. The second myth is that the use of oral contraceptive pills causes infertility, but the data do not support that myth. And then the last myth you mentioned earlier in your program is that although older age is an important risk factor for infertility, 14.2% of women under the age of 30 in South Korea have problems with infertility. So it's not just isolated to the older population in terms of women with infertility. Young women can also struggle with fertility problems.
Okay, so Dr. Tan, my question is, so can infertility be treated, and what are some solutions to that?
Yes, of course, it can be treated, and as in all medical conditions, treatment depends on the diagnosis. So if the problem is primarily obesity, then achieving normal weight can improve fertility. If it's a structural problem, such as a varicocele, then surgery can be an option. For many couples who are struggling to conceive, assistive reproductive technologies such as IVF can improve fertility rates and cause success in up to 54% of cases, which is a quite high percentage. And then, of course, there is the beautiful option of adoption as a way of treating infertility, because of course the result is expanding your family and having a child in your life.
Dr. Tan, before we let you go, I have one more question for you. Do you think the perspectives or perceptions on infertility in Korea is now open enough that people are facilitating healthy discussions?
Well, I think we are having more discussion about this issue because, of course, we have the lowest total fertility rate in the world. Now we're breaking our own records for low fertility rates. And so this is a big concern, not just among people in society, but the government is also very concerned about this issue because in the future, this may cause a lot of problems societally, economically, demographically. People are concerned because we've hit what's called the demographic death cross. In other words, the number of deaths has exceeded the number of births. And so some people are even saying that Koreans as an ethnicity, we may become extinct because our population is declining. And so talking about infertility, of course, is one part of the low fertility rate. It doesn't explain everything. There are other issues as well. But I think that's what's opening up the discussion about this issue.
And hopefully we'll have more discussions in the future. Thank you so much, Dr. Tan. It was a pleasure talking to you today.
Thank you for having me.
Thank you.
Thank you.
All right, and we asked our viewers to share whether infertility is an urgent issue of concern in their countries. Here's what 3 of them had to say. Take a look at the screen to find out. Let's start with Hannah. Hannah said, with educational goals, career aspirations, and personal growth taking precedence over marriage, young Japanese adults now have a narrow window of time to start a family. Tasmia said, as a person from an overpopulated country, I don't see any infertility issues. But since a lot of the younger people are getting married at a later age, some people have children while others don't. Now, the official Peter Kim said, yes, a lot of slow swimmers here in America, poor diet, lack of exercise, and lots of chemicals everywhere. So we can say that a lot of countries, not only outside of Korea as well, are facing infertility issues. But expanding upon what Dr. Tan told us, there seems to be a lot of efforts made by the Korean government to tackle infertility, which is why there are a lot of fertility-related policies. Tell us what they are.
Yeah, just to tell you one, currently the Korean government is providing financial assistance for fertility treatments and 3 days of fertility leave, where you can receive 1 day of paid leave and 2 days of unpaid leave, whereas it's a little more flexible for people who are working in the public sectors. But for specific details, it is advised to visit the Korean government official website to find out exactly how much aid you're entitled to.
I see. And Jiyeon, would you like to add on?
Yeah, of course, yes. As Kyun has mentioned, there are many financial assistance programs for the people, and also tax benefits are provided and some assistance for childcare and education. And I heard that there is public awareness campaigns to address how people think about marriage and the problems itself. And this is actually encouraging a positive attitude to people towards having children. And still, I think I mentioned a little bit about this. There are so many people that are unaware of these kind of programs, the treatments and the assistance program for the government, and they are reluctant to talk about this openly.
Exactly. And as with most of our episodes, I think it really has to do with the way we perceive issues, and how we should look at infertility and tackle this topic seems to be a key question that I'd like to ask you guys now. What do you think about that?
This is a prevalent health issue that's becoming more common among many young people, and it's something that we can always look into, even if we're not preparing to have a baby right now or even marriage. But I think just being a bit more aware and ready in terms of being capable of giving birth to a healthy baby can be like a safer and a smarter way to build a happier life moving forward. And just to add on to what Dr. Tan said, look, there are many people who are very infertile, which is very unfortunate. And if it's hard to get treated, I think choosing the option of adoption is also a good option, because I mean the whole point of giving birth or having a family is having children around you. So I think that may also be an option.
Exactly. And Jiyeon, you mentioned this very briefly before, but I think it has to do with perception. Even though we might have the best infrastructure, it all comes down to how we perceive this issue. Right?
That is right. Infrastructure, you talk about infrastructure. Kyun has mentioned about the fertility leave for 3 days in public organizations. But I do think that should be expanded to private sectors as well, including the freelancers, so that they can enjoy the privilege all together. And that means we could have a family-friendly environment. Right.
Exactly.
Yes.
Like all the national campaigns are trying to promote out there. And hopefully we'll see that, as South Korea is tackling one of the lowest birth rates. So hopefully this issue of infertility is tackled soon. In the meantime, we'll be here every day from 9:30 to 10 a.m. Korea time, bringing you more topics young people are talking about. Special thanks to Park Ki-hoon
Always a pleasure.
and Kwon Ji-hyun.
Thank you for having me.
All right, and thank you everyone for watching. We'll see you tomorrow. We are
News
News
Generation.
Generation.